Hey, good afternoon, everybody. Dr. Mark Fundino here with Davidson Chiropractic. Hope you're well. Just home today, and I was thinking about a patient of mine that I had over this past week, and we've been working with him with some low back pain as well as some hip pain, kind of in that hip joint, um, where the femur or the long bone of the leg meets the pelvis. And he's been doing better, doing much better actually, becoming more mobile, starting to get into jogging a little bit more again, though he knows that he can't do the same distance and length that he used to do. So we've done things like chiropractic manipulation or spinal manipulation, some flexion distraction to open up the joints of the spine, some soft tissue work in the hip area of the glutes, the piriformis muscle, and then we've done some corrective exercise. And this was a good question that he brought up to me was, there's three stretches that I really feel in that hip crease. That's where he always gets his symptoms. And he would focus on a figure four stretch where you would sit down, cross one leg over the other leg, and then kind of flex forward the hip, and you get that stretch kind of in the back of the hip. He also loved doing the hip flexor stretch that we prescribed him. It's where you are basically half kneeling. So one leg kind of in a lunge position, and you lean forward, and you can really feel a pull in the front of that hip crease. And he also liked this adductor stretch. We call it an adductor stretch, where you'd be again in that lunge position, but you take the front leg and put it out to the side, and you lean kind of sideways, and you would feel the pull kind of in the groin area. And he was very animate of how great those three exercises felt. But with all that being said, we also probably had another 5 or 6 exercises of strengthening of the glute medius, the TFL, the piriformis, the midline, the abdominal muscles, the QL, the erector spinae group, which are also so very important with being able to control the hip joint during walking, during jogging. We're always on one leg at any given time during the gait cycle, walking that is. But his comment or thought process, which is understandable, was, I don't really feel it working that area in my hip crease that I have the pain. And I said, you won't feel it. I said, because that's where your symptom is, meaning you're getting that hip crease pain due to probably some arthritic change in that hip joint, or maybe a capsule or a labral tear in that hip joint. But what's going on is, by you working the midline, the erectors, and all the muscles around the spine, you build strength there. And in the glutes, on the back side of the hip, you're going to be able to cause that hip, this is the pelvis, as you can imagine here, and this is the femur where it meets. You're going to cause it to basically work at a more efficient way and stay more in position when you're walking or running. Now, when you don't have the midline strength, or you don't have the gluteal strength, that hip bone is going to be all over the place. It's not going to be able to stay well centrated, and it can't generate a good amount of force, and therefore going to be more prone to wear and tear, arthritic change, degeneration, and things of that sort. Also, you need to keep in mind, I reminded him he needs to keep in mind that a lot of patients who come in with different types of pain, that where they're having the pain has nothing to do with where the problem is. A lot of people with hip joint issues don't even have hip pain, they have knee pain. And so when we're working with a patient, say with knee pain, it's usually about just doing things to help the inflammation around the knee, where the actual tissue's been kind of worn out. But what we really need to correct is the strength of the midline and the hip muscles. So this was a great question. A great thought process of this patient, but I thought maybe many of you would like to know kind of why we do what we do, and we're putting together corrective care programs. There is a rhyme, there's a reason, and we don't want anybody to cherry pick an exercise that I've prescribed or that our clinics prescribe, because they all serve a purpose. So even though one exercise feels really good and you feel like that's the spot that it gets to, it's just one piece of the puzzle. So with that being said, follow our directions, stick with the care plan, and perform all your exercises. Have a great day, guys. Talk to you soon.